Welcome to this edition of The Doctor Is In. I'm Celia Longoria and I'm joined by first on-site physician Dr. Raquel Volado. Today we're going to be discussing vitamin D deficiency. Just what does this mean? Well, she's here to talk to us all about that. Dr. Volado, welcome to the show.
Thank you, Celia.
Okay, we're going to start off by asking a question. What is vitamin D deficiency?
Celia, vitamin D can be found in different forms. And the one that is measured is a 25-hydroxy vitamin D. It's a hormone, so a special test is needed. Vitamin D deficiency is when the level of 25-hydroxy vitamin D is less than 12 nanograms per milliliter or 15 milligrams per deciliter.
And what is the normal level of vitamin D? What should that be?
Well, that depends what lab is doing the test, because different labs have different reference values, different normal values. But generally, normal values of vitamin D should be between 30 and 100 nanograms per milliliter.
If you could please talk to us about why it's important in our bodies, vitamin D.
Vitamin D is essential in our bodies because it helps calcium and phosphorus be absorbed from the foods that we eat. It's also very important in cell regulation and differentiation, so it helps prevent certain types of cancers. Also, vitamin D is important because it helps with insulin secretion and helps our body's immune system.
And I know that there's been a lot of studies done, and we read more and more about that. Like you mentioned, it's been linked to diabetes, to depression, and to other factors as well. So it's important that we make sure that we have proper levels of vitamin D in our bodies.
That is correct, because vitamin D is essential in bone formation. There's a lot of conditions that can occur if we're deficient in vitamin D, such as osteopenia, which is early bone loss. Vitamin D deficiency can lead to osteoporosis. And in children, there's a severe form of vitamin D deficiency called rickets. Okay? If we're low on vitamin D, we can get bone fractures. And like you mentioned, it's also been linked to diabetes, heart disease, strokes, autoimmune disease.
Where do we get vitamin D from, and is there a certain food that we should be eating?
Vitamin D generally we get from two sources, either the foods that we eat or sunlight. In the foods that we eat, there are some foods that naturally contain vitamin D, such as egg yolks, cheese, beef liver, and certain grains. Okay? It also can be artificially added to foods, which is fortified. And most of the things that are fortified, some of the foods are milk products such as yogurt and milk, cereals, as well as margarine and flour. We also get vitamin D from sunlight, and it is recommended that we get at least 15 minutes of sunlight per day, and this is without wearing sunscreen, because our body makes vitamin D from the sunlight.
Now, we live in an area where we're pretty blessed and fortunate that we enjoy nice weather pretty much year-round. So it's kind of nice that we're able to walk outdoors, and like you say, as long as we're not out there for a prolonged period of time, so that we can get our vitamin D.
That is correct. As long as there's a little bit of sunlight. It can be early in the morning or before the sun goes down. It doesn't necessarily have to be like during the midday when the sun is very, very hot.
Now, I know we touched briefly on milk, and I know that we're always hearing parents talk to their children about the importance of drinking milk. Why is that important?
Milk is a very good source of vitamin D because it's been fortified. They know exactly how much, international units of vitamin D to put in the milk. So 3 glasses a day is a very good amount for children.
Who's at risk for having vitamin D deficiency?
Vitamin D deficiency, the populations at risk are the elderly, the aged, because as we age, it is harder for the skin and the body to produce vitamin D from sunlight. Also, patients who have dark skin, because the darker our skin, the more melanin there is, which is the pigment that provides our color. And the more melanin we have, the harder it is for the skin to make vitamin D. Also, the obese population, those with a BMI greater than 30, because we know and we're finding out that fat absorbs vitamin D, so it's not out there to be used.
I know we also talked about people that are strict vegetarians and also persons with certain digestive disorders.
That is correct. Strict vegetarians can have a greater risk of having vitamin D deficiency because they're only eating vegetables and not the foods that have vitamin D, such as cereals, milk products. And those with malabsorption syndromes, celiac disease, also Crohn's disease, because they're not able to absorb the vitamin D that they're eating.
And what about people that have had recent gastric bypass surgery? How would that affect them?
Oh, no. Also, they're at risk for vitamin D deficiency. One, because they have smaller intakes of food throughout the day, so they may not be eating enough food to get the proper amounts of vitamin D. And Celia, also a population that needs to be mentioned are patients with chronic kidney disease, such as diabetes, because it's prevalent here in South Texas. Patients who have chronic renal disease, it's harder for them to convert vitamin D to its active form, which is calcitriol, for the body to use.
Oh, that's very interesting. So, Dr. Volado, how much vitamin D should we be taking in daily?
That depends on the population, but it's recommended that from 1 year of age to 70 years of age, and also pregnant females, should be having at least 600 international units per day. And those above 71 years of age, they should be taking in 800 international units per day.
And what about if we think we're not getting enough vitamin D? What should we do as far as supplements?
Okay. The good news is there's plenty of supplements out there that we can get a hold of. They can be found anywhere in grocery stores, vitamin stores, in the vitamin section. And vitamin D comes in the 400 to 1,000 international units. Also, for women over age 50, they can buy the combination calcium plus D. Generally, it's calcium 600 milligrams and vitamin D 400 international units. Also, there's a super potent vitamin D that's a prescription. It's called ergocalciferol, and it comes in 50,000 international units. If your doctor feels that it needs to be prescribed for someone who is deficient in vitamin D, then they can prescribe it. Since it's super potent, generally it's given 1 time per week. It's 1 capsule per week.
And I know here, like we've been talking about the valley weather, it's also called the sunshine vitamin, and we just need to be making sure that we're getting plenty of it.
That is correct. And just a word of caution, for patients and people not to wear long sleeves or wear sunscreen because they're not going to be able to make enough vitamin D if their body's covered up.
Well, I think we've covered all of the different areas that we were going to focus on today. And I don't know if there's anything else that you would like to add, but we thank you for being here on our show today.
Thank you.
Well, that's it for this edition of The Doctor Is In. Thanks for watching, and we'll see you next time. Make sure you go out there and get some sun.